Every 33 seconds, someone in America dies from heart disease. While you sit here watching this video, another family is getting a phone call that will change their life forever. The most dangerous part is not how deadly heart disease is. It is how silent it can be. No dramatic warning, no obvious countdown, no clear signal that something catastrophic is about to happen. For millions of Americans, the first symptom of heart disease is a heart attack, and sometimes that heart attack is fatal. Heart disease remains the #1 cause of death in the United States. It kills more people every year than all cancers combined, yet many people believe it will never happen to them. Today, we are going to break down exactly what heart disease is, why it is so common in America, the early warning signs most people ignore, and most importantly, what you can do to protect yourself before it is too late. This is not just another health video. This is information that could save your life. Section 1. What heart disease really is. Heart disease is not a single condition. It is a broad term that includes several disorders affecting the heart and blood vessels. The most common and deadly type is coronary artery disease. Your heart is a muscle. It pumps blood throughout your body every second of your life. But in order to do that, it needs its own supply of oxygen-rich blood. That blood travels through coronary arteries. Over years, sometimes decades, fatty deposits called plaque build up inside these arteries. This process is called atherosclerosis. Plaque is made up of cholesterol, inflammatory cells, calcium, and other substances found in the blood. At first, this buildup causes no symptoms. The artery slowly narrows, blood flow becomes restricted, the heart works harder. Then, one day, the plaque can rupture. When that happens, a blood clot forms rapidly at the site of the rupture. If the clot blocks the artery completely, blood flow stops. Without oxygen, heart muscle cells begin to die within minutes. That is a heart attack. It doesn't happen overnight. It is usually the result of damage that has been building quietly for years. Section 2. Why heart disease is so common in the United States. Heart disease did not become America's leading killer by coincidence. Several powerful lifestyle and environmental factors contribute to this crisis. Diet. The modern American diet is heavily based on ultra-processed foods. These foods are high in added sugars, refined carbohydrates, unhealthy fats, and sodium. Sugary beverages, fast food, processed meats, packaged snacks, and oversized portions have become normal. Over time, this dietary pattern leads to chronic inflammation, high LDL cholesterol, insulin resistance, weight gain, high blood pressure. Each of these factors damages blood vessels and increases heart disease risk. Sedentary lifestyle. Physical activity levels have dropped significantly over the past decades. Many Americans spend most of their day sitting. Desk jobs, long commutes, screen time, and digital entertainment mean that movement is no longer built into daily life. The heart is a muscle. If it is not regularly challenged through physical activity, cardiovascular fitness declines. Lack of exercise contributes to obesity, high blood pressure, and poor circulation. Chronic stress. Modern life is fast-paced and high pressure. Work demands, financial stress, lack of sleep, and constant digital stimulation keep stress hormones elevated for long periods. Chronic stress raises blood pressure, increases inflammation, disrupts blood sugar control, and damages artery walls. Over time, this internal stress environment accelerates plaque buildup. Obesity and metabolic syndrome. More than 40% of adults in the United States are classified as obese. Excess body fat, especially abdominal fat, acts like an active organ. It releases inflammatory chemicals into the bloodstream. This inflammation contributes directly to atherosclerosis. Obesity also increases the risk of diabetes, high blood pressure, and abnormal cholesterol levels.
Smoking and tobacco use. Smoking damages the lining of blood vessels. It increases clot formation and reduces oxygen delivery. Even though smoking rates have declined, millions of Americans still smoke, and vaping has introduced new cardiovascular concerns. Section 3. Early warning signs most people ignore. One of the most dangerous myths about heart disease is that it always causes severe chest pain. In reality, symptoms can be subtle. Chest discomfort. This may feel like pressure, tightness, heaviness, or burning. Some people describe it as indigestion. Shortness of breath. Feeling winded after minimal activity can signal reduced blood flow to the heart. Unusual fatigue. Extreme tiredness, especially in women, can appear days or weeks before a heart attack. Pain in the jaw, neck, back, or arm. Heart-related pain can radiate beyond the chest. Nausea or lightheadedness. These symptoms are often overlooked or misattributed to other causes. Ignoring these warning signs can delay life-saving treatment. Section 4. Who is at higher risk? Certain factors significantly increase the risk of heart disease. High blood pressure, high LDL cholesterol, low HDL cholesterol, diabetes, smoking, obesity, family history of heart disease, age over 45 for men and 55 for women. However, an alarming trend has emerged. More young adults in their 30s and 40s are experiencing heart attacks compared to previous generations. Sedentary habits, poor diet, sleep deprivation, and metabolic disorders are appearing earlier in life. Section 5. The role of cholesterol. Cholesterol is often misunderstood. Your body needs cholesterol to build cells and hormones, but high levels of LDL cholesterol can deposit inside artery walls. HDL cholesterol helps remove excess cholesterol from the bloodstream. When LDL levels are high and inflammation is present, plaque buildup accelerates. Regular blood tests can measure these levels and help assess risk. Section 6. The impact of high blood pressure. High blood pressure is known as the silent killer. It often causes no symptoms, yet it places constant force against artery walls. Over time, this pressure damages the inner lining of arteries, making them more vulnerable to plaque buildup. Nearly half of American adults have high blood pressure or are taking medication for it. Many don't even know they have it. Section 7. Diabetes and the heart. Type 2 diabetes significantly increases heart disease risk. High blood sugar damages blood vessels and nerves that control the heart. People with diabetes are more likely to develop coronary artery disease at a younger age. Insulin resistance, which often precedes diabetes, is strongly linked to cardiovascular damage. Section 8. Women and heart disease. Heart disease is the leading cause of death for women in America. Symptoms in women may differ from those in men. Women are more likely to experience fatigue, shortness of breath, back pain, nausea, jaw pain. Because symptoms can be atypical, heart attacks in women are often misdiagnosed or diagnosed late. Awareness is essential. Section 9. Prevention strategies that work. The encouraging truth is that heart disease is largely preventable. Dietary improvements. A heart-healthy diet emphasizes vegetables, fruits, whole grains, lean proteins, legumes, nuts, and healthy fats like olive oil. Reducing added sugars, refined carbs, fried foods, and processed meats significantly lowers risk. Physical activity. At least 150 minutes of moderate intensity exercise per week is recommended. Brisk walking, cycling, swimming, or strength training all improve heart health. Even small increases in daily movement can reduce risk. Weight management. Losing even 5 to 10% of body weight can improve blood pressure, cholesterol, and blood sugar. Sleep. 7 to 9 hours of quality sleep per night supports cardiovascular health. Poor sleep increases inflammation and blood pressure. Stress management. Mindfulness, breathing exercises, therapy, social connection, and time in nature reduce stress hormones and protect the heart. Regular medical checkups. Know your numbers: blood pressure, total cholesterol, LDL and HDL, triglycerides, fasting blood glucose. Early detection allows early intervention. Section 10. Medical treatments. For those already diagnosed with heart disease, modern medicine offers several treatments. Statins lower LDL cholesterol and reduce plaque progression. Blood pressure medications reduce strain on arteries. Antiplatelet medications reduce clot formation risk. Stents can open blocked arteries. Coronary bypass surgery reroutes blood flow around